Hi, my name is Juliet, and I'm with Ashton Kelleher. I'm going to talk about a preliminary study we did to be able to understand occupational therapists as we work to deploy a home-based rehabilitation system in patients' homes. We did this in order to be able to incorporate their needs and values when designing such systems. So currently, the healthcare space is moving towards more home-based community care, and that looks like a rise in telehealth, especially in the wake of the pandemic. We see an increased need for rehabilitation services for people with debilitating but survivable illnesses. And so prior work has focused on using consumer products to try and meet these needs, or the rise of wearable devices like Fitbits or Apple Watch. So our lab is focused on designing telehealth systems like this for stroke survivors, in aiding them in physical rehabilitation. So we conducted a survey with 17 therapists and then conducted 10 interviews over Zoom, all of them from the community in Virginia and the United States. And then we transcribed the interviews and analyzed them using grounded theory. So there's 4 main things we pulled out from the results of this interview and survey study. First was the goals of the patient, that they desire to build a relationship with the patient and be able to aid them in long-term care. So as one therapist said, I'm not teaching you what to do, that way you can come, I'm teaching you what to do, that way you can come to me for a short amount of time and to do this on your own. So preparing them for long-term care on their own without them. They talked about caregivers and how they have a big impact on their understanding of the patient, their condition, their capabilities. That sometimes the patient will say, oh, I'm doing great. And then their caregivers will say, no, that's not the case. I'm having to dress them. They also provide knowledge hubs that therapists can pass on expertise for long-term care. They talked about ethical work challenges. So the tension between having these documentation standards placed on them, but wanting to give proper attention, time, care to their patient. And as they've been pushed to have more patients with less time, they feel that they feel that delivering quality care is more difficult. And finally, they talked about having to prove the value of their therapy, that they should be compensated for their time, and that the patients do require the skills that they are able to offer them. And so from that, there's 3 main findings that we pulled out. The first, the importance of maintaining that patient-therapist relationship, being able to personalize the approach, to motivate the patient to adhere to their therapy activities is really important for the therapist. They want to keep them moving forward. And there's also importance to avoiding placing technologies that would inhibit that relationship as well. Second, involving the caregiver. The caregiver, as we've seen, is an important part of that team for helping the patient through rehabilitation. But at the same time, it's important to consider the trust that the patient and caregiver share with one another. So being able to know what data is shared with who talks to whom, will allow them to maintain that important information passing, but still keep the relationship strong. So finally, providing proof of care and patient progress. And this could look like pre-filled templates, data from home systems, anything that supports the therapist in automatically transcribing things to share with insurance companies. But it's important that they don't place additional time constraints on therapists, as they are already pressed for time in their daily work lives. So key takeaways: importance of the relationship between the patient and therapist, importance of the role of the caregiver in the recovery team, and that there are these tensions that therapists encounter in their daily practice that have to be considered when designing telehealth solutions. So even though this was conducted with respect to rehabilitation, it's true for any home-based care or health setting. So I want to thank you for your time. This work was sponsored by the National Science Foundation. And if you have any questions, thoughts, or would like to know more about our work, please feel free to reach out to us. Thank you.